Just see if it works. Yes. Well, good afternoon, everybody, and our session on global health and a kind of a story of April Gamble, her journey as a global health professional. We're really excited that you were able to join us, April, and that you were willing to share your story with us. We're definitely going to learn quite a lot of you. Most of us here are very interested and they're kind of curious about what we can learn, because this is really a different story that we know mostly here at university, which goes quite a lot about musculoskeletal care or something which is very close into a localized version. And now we go to a more a globalized version. So welcome, and the word is up to you.
Thank you so much. I'm very excited to be here, and I'm excited to kind of share my journey and kind of some key principles on global health. So as you said, my name is April Gamble. I'm originally from the US. I went to PT school there. And then after PT school, I moved outside of the US. So I've been living outside the US now for, I don't know, 8 or 9 years. I am the secretary for the Global Health Special Interest Group of the American PT Association. I'm also the founding chair for the Global Outreach Committee of the Oncology Rehab SIG in Michigan, my state chapter. And so today we're going to be talking kind of through my professional journey. I hope that you understand some key terms related to health justice, explore some principles of global health and justice-centered healthcare, and then also just to that you gain awareness of different opportunities that you all as allied health professionals can have within global health and within working towards health justice. And I do kind of this presentation for lots of different student groups, and it makes me often excited because it's a presentation I wish I would have had when I was in PT school, because I didn't know that this kind of professional opportunities, that this kind of field was available. So I hope that I can kind of open your eyes to some of the unique work you can do as an allied health professional. And so I'm coming to you today from the Kurdistan region of Iraq. You can see the region there highlighted in green. So it's the northern region of Iraq. It's a semi-autonomous region, which means that it has its own government, and it has a very unique culture and different context than the rest of federal Iraq, but it's still underneath the federal Iraq country context. And it's a very diverse region with lots of languages, people from all kinds of backgrounds. And I've been here for actually today, I think, marks my coming on my 4th year of being in this country, which I never thought I would kind of settle in Kurdistan, Iraq, but here I am. And you can see some of the beautiful pictures from the region. And so I hope to share some of my experiences from this region as well. And before we officially get started, I'm going to do a land acknowledgement. So this is something we do to honor the request of Indigenous populations around the world. It's something that is recommended to do before all public events. And it's very commonplace in places like Canada and New Zealand and Australia. But I don't know if you've been exposed to it before. And it's definitely not common practice in the US yet either. So the land acknowledgement is based on the land where the presenter is. So because I'm in Kurdistan, Iraq, I'll conduct the land acknowledgement from this land, its history, and as recommended by the people from here. So the land acknowledgement just goes as follows. I recognize that Kurdistan is seized and divided land of Nataway Kurd, or the Kurdish nation. Nataway Kurd encompasses about 15 million people that are without a country, that are stateless. We pay our respects to elders, both past, present, and emerging, of Indigenous people that have stewarded this land throughout generations. Those of us that are settlers are grateful to have the opportunity to gather and work and play and live on this land. And we'll have a moment of silence now for the pure souls of martyrs, for those that have died defending the land and freedom of Nataway Kurd. All right, so we'll get into the presentation a little bit. So you may be familiar with the definition of global health, but you can see it's an area for study, research, and practice that places a priority on improving health and achieving equity for all. And I like to put in there, and in working towards health justice. So if you take a look at that picture there on the left, we can think of equity is where everyone gets the support they need to have the same to have and achieve full health and functioning. So they might get different support, but they can all have the support they need to achieve health, and in this case, to achieve rehabilitation or wellness. And then if you look at justice, though, that means actually removing the systemic barriers that exist within our different societies that make it difficult for people to achieve health. So the work that I do is really striving towards health justice, and as well as global health is always working to work towards health justice and health equity. And just to clarify, global health does not mean international health, right? Global health can be done anywhere you are, any context you're in, any country you're in, because it's really striving to work alongside communities to help everyone get access and to benefit from health and wellness and rehab. So a big part of working towards health justice to me is really embodying principles of health justice. And it's not about necessarily the work I do, the projects I do, which I will share with you. It's really about what values I have within myself and how I live those out when working alongside communities. So I started doing this recently when I do presentations. I started doing personal statement. And so I'm going to share that with you now. And really my hope is that my personal statement illustrates the lifelong journey of self-reflection and learning that it takes to effectively work alongside communities and alongside patients. And I also hope that it reveals how I can take responsibility for our positions of privilege and advantage and start to normalize within our different professions the language and how we talk about how our personal histories and our positions of advantage and privilege actually shape and influence our professional work. And one approach that I have as well as is really recognizing that when we learn and grow, we often do that through our bodies. And we all know that as allied health professionals, right? You do labs where you're working with your body, especially as those of us who are physios, you're working with patients, specifically giving them opportunities to learn and grow through their bodies. But sometimes when we're in academic settings or in conferences like this, we forget that a lot of our learning needs to happen through our body. So through this personal statement, I just want to give you an opportunity to connect with this idea of health justice, not just from a cognitive level, but actually from your body level. So what I'm going to ask is when you listen to my personal statement, that you close your eyes, you don't need to look at me or anything, and just be present. If you're multitasking, kind of come here and listen and be present and notice as you're listening to my words, notice the physical sensations that arise, the thoughts, the emotions. If you notice your attention drift, just bring it back and just kind of see what arises for you as you do that. My preferred pronouns are she, her, hers. I was born and raised in Michigan as a descendant of European immigrants that traveled to the States like so many before and after with the hope of a better life. I respectfully acknowledge that my birthplace is seized territory of the Anishinaabe. The wealth, power, and advantages that I experience, including where I live now in Kurdistan, Iraq, are the result of colonization and the enslavement of Black people. The unearned opportunities that I have as a white American come at the expense and suffering of many. I am taking responsibility for this and for my role in upholding systems of oppression. My work as a physiotherapist is embedded in my core belief that we can create a world where justice is the reality for all. I lean into experiences of discomfort to drive my personal growth. So I come equipped to mobilize effectively under the leadership of those that face oppression every day, to revolutionize rather than retreat. I will make mistakes. I will unintentionally oppress and silence. I am asking all of you to keep me accountable, as I know that it is the impact of my actions that matter. As my own healing, freedom, and opportunities are intimately interconnected with those of every human, I do not come to save or to heal or to fix. Rather, I strive to create a space where differences are celebrated, where collaboration breeds growth and healing, where acts of resistance to assimilation and oppression are embraced, and where a new way of being can be imagined within ourselves, our patients, our profession, our organizations, and our communities. Good, and you can bring your attention back. If you feel like you need to move or something to release that, you can, and maybe after I'll have some of you share kind of your experience with that. All right, so we're going to be talking again about health equity and justice. And as Martin Luther King says, of all forms of inequality, injustice in health is the most shocking and the most inhumane. And really, as allied health professionals, it is our responsibility to work towards health equity and justice, to create a world and communities where we can all have the same opportunities to benefit and achieve health and functioning. I pulled a couple quotes from an article here. This is talking about disparities specific to the US, but I thought it would be a fairly similar context to where you all are in a high income country. So you can see health disparities, which is very connected to health justice and equity. So health disparities are differences in the incidence, prevalence, mortality, and burden of disease that exist among specific population groups. And so when working towards health justice, we're really working to reduce health disparities. So reduce differences between different groups. And here are some examples of health disparities that are prevalent even in high income countries. So for example, when people live further away from urban areas and further away from rehab centers, they have less access and less benefit from rehab. Also, you can look at gender. So some of these are fairly interesting. So women are less likely to be discharged to inpatient rehab after acute treatment. And then you can also see that age. So older adults are less likely to be discharged to inpatient rehab after a stroke. So these are some of the interesting health disparities within even high-income countries. And what we're looking at, though, is looking at really what are the systemic factors that are existing in our different societies that are preventing those equal access and equitable access and benefit from rehab. And so you can think of that like the fence within this picture. What are the wooden fence? What is the wooden fence within our different communities that prevent people from benefiting? And so I'm going to tell you think of a patient and case example. So if you have a patient coming in, you saw them for the assessment and you're in an outpatient setting. So they came for the assessment, but then they didn't show up for the first treatment session. And so you may, as a professional, you may have thoughts, which is really common, like, they're lazy, they're not motivated, they don't want to get better. It's not their priority right now. We sometimes use the term like non-adherent. But if you were framing your clinical practice from a health justice perspective, you would frame that differently. You would really act from an understanding that the root causes of why some do not access or benefit from rehab are social, political, environmental, and economic, and not based on a person's behavior or biology. So in that case, rather than thinking, they're non-adherent and they're lazy or not motivated, you actually think, well, what's going on here? What are the environmental and social barriers that's preventing them? Maybe they have kids at home and they don't have access to childcare and they don't have family members to help them. Maybe they don't have a car and they rely on public transportation that takes, an hour to get there. Maybe their employer doesn't allow them to leave work. So rather than putting blame on the patient, you're actually looking at the bigger system that the patient exists in and thinking, what is my role here? How can I help the patient access and benefit from these rehab services, because there are systemic barriers that's preventing them and giving them an unearned disadvantage compared to people who don't face those barriers. And we know in many contexts that racial and ethnic minority groups have a greater impact from these barriers. They have greater health disparities, and you can see one there specific to rehab. And in the US context, which I can speak of because that's what I'm more familiar with, is because of systemic racism within our healthcare system and because of racism within our policies, racial and ethnic minority groups do not have the same opportunities for health and functioning. And that is not just because of policies within healthcare, but also because of policies in public transportation, in employment, in education, in housing, and all of that compounds together to create these really difficult systemic barriers that don't allow people the same equitable access and benefit. So I want to kind of open it up to the inner circle here. And do you all have an example of some of those systemic barriers that you maybe see within your context? What are some of those barriers, social, political, environmental, that make it difficult for people to access or benefit from the allied health services?
information, maybe
Mm-hmm.
the information that they have about the healthcare system or how to reach the healthcare system.
Oh, yeah. So maybe access to that information, and then so that they can actually know how to access the services. That's a nice one.
Yeah, maybe understanding. That's something I know. Maybe so maybe people from refugees or other people, same as COVID measurements, for example. Sometimes really hard for them to interpret the information available. So
also that the information isn't presented to them in a way that they can understand, whether that's language or educational level. Yeah, nice. Anyone else?
I think it's a barrier from the other side, but in a context I know, there's just a lack of healthcare. So people want to go, they just don't know where because it's either too far. So it's like barriers from both sides. There's not enough healthcare, but there's also no transportation or a way to it.
Yeah, those are good examples where they all kind of build up on each other, right? Anyone else want to share?
Well, I might.
Please, Mike, do.
Yeah. Well, thanks, April. Yeah, a couple things. I think one of the barriers here is also the perception of physio or rehabilitation, not just among patient populations, but among other influential healthcare infrastructure, physicians, others, where they often become a quarterback or leader of information flow. I think COVID-19 has, on the one side, helped us reinforce that, and alternatively, really kind of stir it up a touch. But April, if I might, the first part of what you said just really resonated with me. Also, so I live in the United States as well. I'm Canadian. I live in the United States, where we are now looking at a concept that you'll be familiar with is called intergenerational trauma. So again, in the United States, dating from moments of slavery hundreds of years ago, and how those ideologies, thoughts, traumas have been brought forward into the future, into the current day and into the future. And so you're absolutely right. And I'm 100% with you that a patient who just appears before us is not just the body, that there's a whole history that comes alongside with them. So I thank you for opening up that conversation.
Yeah. Thanks for sharing, Mike. And I think it's hard to remember that when you're just seeing patients, every hour, however often, right? It's hard to kind of zoom out and see like the system that they live in, and also to recognize our role potentially in contributing to that system and how we might be replicating that harm and that oppression. Great. So we'll move on here. So hopefully I kind of just set the stage to say that, providing justice-centered health is really the responsibility of all of us as providers, whatever our profession is. So what I'm going to do is kind of show you my journey of how I do that now, but also how I came to kind of discover that, because I think when I went to physiotherapy school, that wasn't really a topic of discussion, right? It wasn't something I was aware of. So I kind of had to discover it on my own. And along with other great mentors like Mike on here. So as the best way I found to describe what I do is a global health professional that utilizes a justice-centered approach to work alongside historically marginalized communities to strengthen rehabilitation services. So my background is physiotherapy, and what the different specialties I've kind of developed along the way is, one, as an educator. So I do a lot of education, clinical supervision, often in the role of like a clinical instructor, where I always provide direct patient care alongside physiotherapists from the country that I'm living in as a way to build capacity. The other kind of skill set I've developed is modern pain science, as well as mental health physiotherapy, so working specifically with survivors of torture and war trauma and using body-based strategies to support mental and physical health and functioning. And then I've also developed skills in cancer oncology rehab. And all of these kind of, though, come together within a global health framework. So as a global health professional, my if you ask me like what I'm going to do tomorrow, I actually have no idea. My days are all different. So I can't really lay out a whole, this is what I usually do. But kind of the different areas that I work in. So one is clinical practice. So I do work with patients regularly, but I always do it alongside physiotherapists or other allied health services here. And it's usually within a capacity building setting, but it's also just so that my presence as a white American doesn't minimize the skills that are available within the region. So if I just went out and practiced on my own, then I'd really be minimizing and harming the local infrastructure and local healthcare system. So I also do a lot of education and clinical supervision. So building up the skills of physiotherapists, but also social workers, counselors, case managers, nurses, a variety of different professionals. I also do a lot of program development, which means working alongside an organization or institution to develop a treatment service. That includes a service model, includes training the staff, includes documentation, referral networks, and really setting up a whole new service. And then I also do research because that is an important part of working towards health justice. And then lastly, I do advocacy and activism, really with the aim of helping support the needs of historically marginalized communities. So I'll give you a little examples here, but like many of you, I did physiotherapy school in the US, and then I did a service trip as part of my physiotherapy program to Guatemala. It's like a 2-week service. And so it did kind of open my eyes to what unique roles I could play as a physiotherapist. And then after PT school, I did a neurological residency, which was in the US, and it was mainly focused on working with persons with traumatic brain injury. And even though I don't work in neurology consistently now, I do think that was really foundational for me because it had clinical mentorship built into that. And so I got to develop my skills in evidence-based practice better so that I really understood how do I take what the client needs and as well as what the evidence says and how do I deliver patient-centered care. And it also really helped me, especially working with people who have experienced traumatic brain injuries, to see the patient in a bigger system, to not just see the impairments in front of me, but really to understand what is the system and the community and the different influences that are either supporting or making it difficult for that person to access function and their optimal level of functioning. So I think that has played a big part in my global health work. So after the residency, I wanted to work outside the United States. I kind of thought it would be like a year, then I'd go back and be like a normal physio in the US, but that was like 8 years ago now. And I don't intend to ever go back and move to the US. So when I was first looking for that first opportunity, I wanted to work with patients because I was new still. I really wanted that clinical care and experience. And then I also wanted mentorship, both in clinical care, but also in like global health and working in different cultures and contexts. So the position I took was in China. So I was in Beijing, China. I worked with an organization called Olivia's Place. So in that picture is Olivia. She has Down syndrome, and her parents started Olivia's Place because when she was born, they couldn't find any quality rehab services for her. So they decided to start their own, and it's a multidisciplinary rehab clinic that now has really evolved with the aim to develop pediatric rehab services throughout China and improve the standard of care in China. And also I saw lots of different patients within that context in different settings, from orphanages to schools, to private clinics, to public clinics. And then I also got my first experience doing program development. So I worked with one of the private hospitals in Beijing to establish the whole country's very first rehabilitation inpatient setting. So I worked with the leadership there to develop policies and procedures and train their staff to implement that first rehab center. So through that experience, I really enjoyed program development, and I really enjoyed working alongside national staff and kind of building capacity and working with them. And I was in China for about 2 years, and within that I took kind of a holiday and traveled, and did a short-term experience with LIMS International. So I'm sharing that for those who look for short-term experiences. I do think LIMS International is a good one where if you go, they have a long-term sustainable initiative. So even though you're only there for 2 weeks, you're really contributing to a bigger picture. So I think they do it well, and they seek to provide affordable prosthetic solutions in developing contexts. So after being in China for 2 years, I was kind of done with China, but I wanted to stay working outside the US and in global health contexts. And really my priority was still to have connections with patients, because as you start to develop within global health or within humanitarian settings, you can often move further and further away from patients. And I think that's also true in some clinical settings, where as you develop, you become administration and you move further and further away from patients. But I really wanted to stay connected to patients. And so the next opportunity I did was in Jordan. So that picture there is in Petra, walking into Petra at night with my brother. And so in Jordan, I worked for the Center for Victims of Torture, which is an international NGO based out of Minneapolis. Those are my team of physios there. We were on a self-care outing, and we're teaching the women how to ride bikes, which was fun. And so within that, it was a multidisciplinary center that had physios, social workers, counselors, and case managers. And the goal was to provide services to support the mental health of survivors of psychological trauma. So mainly refugees from Syria, Iraq, and Sudan. And here I developed skills in trauma-focused physical therapy, which is physio that works to address the mental, physical, and social functioning of persons affected by psychological trauma, and specifically war and conflict. I also developed a lot of skills here in modern pain science, because a lot of the clients would come in with persistent pain conditions. And so I really enjoyed working with this team and uptraining them in some of the modern pain science concepts, and kind of continuously improving our services to access different populations within Jordan. So after I was in Jordan for 2 years, I moved to Kurdistan, which is where I am now. I moved there initially with the Center for Victims of Torture, that same NGO. And I worked with 2 local NGOs with their physiotherapy team, specifically for survivors of trauma. And we did a lot of work to develop programs for female survivors of sexual violence, whether that was in the home or with sexual violence related to the conflict with ISIS. So we did a lot of development around that to increase access to rehab services throughout the region. So I was with on that project for about a year, and then it lost funding with the Trump administration. And so then I was kind of like, okay, what am I going to do? And so what I decided was actually to stay in Kurdistan, because I felt very connected to the region. And I decided to go freelance rather than try to pursue a job with one organization. And why I decided that was because when you're working with an organization or institution, you always are bound to their agenda and to their objectives. And especially when you're doing humanitarian work, you're also bound to the objectives of the funders, the ones who are giving you money. And what I found was that that was often not aligned with what the people in the communities were telling me they wanted and wanted to do. So I felt that conflict. So I felt by going freelance, I can actually better respond to the community. And I can, and that's what I found too, being freelance now for almost 3 years. I find I can better respond to the community. I can better live out my own personal values. And I can better bring together different people and different communities to work towards health justice. So to allow me to be freelance, I created my own LLC in the US and company, and that just gives me a financial platform to allow to have kind of financial consultancies with different companies. So one organization that I've worked with now is that I consistently work with. I'm the physiotherapy director, is Wijchen Organization for Victims of Human Rights Violations. So they're Kurdish-led local NGO. And we mainly provide interdisciplinary services in prisons and detention centers. The picture there is the clinical team that works in the prisons. And we recently published an article on our RCT for the treatment service in the prison in Torture Journal. That organization, we also do a lot of program development. It's very responsive to the community. So recently the prisons really said they have a huge increased need for people with substance use disorders or addiction. So we're currently working to develop a interdisciplinary service, including physiotherapy and counseling, to help support people who have addiction problems. So another project that I did was through the International Association for the Study of Pain. So it's a small grant. And this really came about because people, physios and medical doctors in the community, were getting exposed to modern pain science and to this biopsychosocial approach to pain, but they wanted more. So then I applied for funding to see if we can do some trainings and build some programs. And so we got this small fund that allowed us to do that. So we created Beyond Pain, which is an evidence-based and multilingual pain science training and treatment manual. So you can go to that link there and get it for free. It's in English, Arabic, and Kurdish. And it's really designed specifically from the experiences of many of us colleagues here in Kurdistan on how do you train people, healthcare professionals, in these principles of biopsychosocial pain, and some really specific ways to how do you educate people about pain that are really specific to using metaphors, analogies, and stories specific to the context and culture of the Middle East region. So I also work consistently with Dignity, which is the Danish Institute Against Torture. They're an international NGO out of Denmark. And so they have developed a treatment called the Pain School, which is a group treatment for people who are affected by trauma and who struggle with persistent pain conditions. So in my role, I am one of the trainers for the Middle East, North Africa region. So right now we have, I think, 30 physios from 8 different countries coming together, all learning how to deliver this pain school treatment service, and then they deliver it within various contexts throughout the region. And like many of you, because of COVID, we've moved some of the training and activities online. And it's really been actually a really nice opportunity because we were able to include more people because it was online rather than having to make everyone travel to Jordan, which was the original plan. And it allowed for some really nice interaction and sharing because all of these professionals work with survivors of trauma and torture in different contexts, and it really gave great opportunity for them to share and learn from each other. So there's definitely some benefits to COVID. And then I also work with Heartland Alliance International, another international NGO. So for them specifically, I developed a program to support the mental and physical functioning of adolescent boys who had been affiliated with ISIS and were now currently detained in detention centers on charges of terrorism because of their forced affiliation with ISIS. And so I worked in the juvenile detention centers alongside these adolescent boys to understand what challenges they were facing, the physical and mental health problems they were facing, and then developed a group session manual to support them and give them skills to have improved resiliency as they continue to be in these really difficult situations of being in the detention centers. And then as they go out back into their community and have a lot of challenges with reintegrating. And so we started in one detention center as a pilot, and now it's spread through 4 detention centers throughout Kurdistan and Iraq. And we've seen lots of great impact in these boys and in their ability to then advocate for themselves and go and reintegrate back into the community successfully. Another unique thing that I do is I work for Boston Biopharma, which is a pharmaceutical company. So I never thought I'd work for a pharmaceutical company because you kind of hear like they're like the devil, you know. But I feel like this company specifically aligns with my values. They seek to do like affordable pharmaceuticals in developing contexts. So I work for their Middle East Corporate Social and Responsibility Division. So what that means, essentially, they pay me and give me money to go to public hospitals within the region and build relationships. So within the public hospitals here, I would go and say, like, how can we help you? Like, what kind of capacity building, what kind of program development do you want? And then I had a lot of freedom to do what they thought the community wanted. And so in hospitals here, we specifically developed oncology rehabilitation services, the first time in the region of doing that, as well as educational interventions for children with hemophilia. And then I am recently part of a global initiative to work towards health justice for persons impacted by breast cancer. This is led through Turning Point, which is an NGO out of Atlanta, Georgia in the US. And it's a global group of 8, mainly physios. We have 1 physician, that's working towards health justice for people with breast cancer. And we're really right now looking, we just kind of started in this last year, and we're looking to deliver telerehabilitation services and platforms that can allow increased access for historically marginalized groups. And specifically in Kurdistan, we hope that this will catalyze us to be able to do sustainable breast cancer rehab services within Kurdistan. So that's what we're hoping this will kind of kickstart us here. And then I also recently started a project here that's looking to develop interdisciplinary community-based services to strengthen the resiliency of children, families, and communities impacted by ISIS. So the conflict with ISIS is officially done in the region, but it's left lots of challenges within the region, lots of distrust, lots of lack of cohesion, lots of people who have significant psychological trauma from the impact of ISIS. So working with local NGOs who are already part of these communities and equipping them with skills and developing training programs that help increase resiliency and mental and physical functioning for these different groups. And lastly, I do a lot, like I said, a lot of advocacy and activism. And part of that is doing groups and lectures like this to just kind of increase awareness of global health and the role of allied health professionals. And something that's also really important to me is there's a lot, I do a lot of international conferences, but really I strive to bring my colleagues here in Kurdistan and give them an opportunity to present at those kind of international conferences and to have a voice within these international platforms. So yeah, that's kind of a summary of the different work I do and how I do it. And really for me, it's not just about the work and the projects, but it's really about consistently embodying the knowledge and skills to actually work effectively alongside communities and under the leadership of communities. And that is an ongoing process, an ongoing learning. And I hope that I've kind of got you all interested and see that, justice-centered rehab is your responsibility as a health professional. And it does take a lot of personal learning and growth. And that you can do it anywhere you are. It doesn't have to look like my projects and my career. And also that you have every moment, every day, you have an opportunity to do that with alongside your patients and really take a health justice lens and look beyond the individual and look at the different systems that we exist in and that we contribute to. I did provide some resources if you want to start learning more about that, but I'll stop sharing my screen and we can just open it up for any discussion or conversation.
Well, first of all, thank you very much, April, for sharing your story with us. This is, yeah, I'm looking at Hanneke, who's sitting in front of me. So it's kind of, well, this kind of a story, and it does make a difference in how we perceive it. So, well, that's first for me. It goes a little bit deeper than just looking physiotherapy from an outside lens, and you make physiotherapy something which is more ingrained into humanity, into livelihood in itself, and seeing yourself as well. That was the first bit when you started to talk. It's kind of, who am I in relation? So it's kind of, it's not so egocentric that it sometimes is from a consumer perspective. You are completely a part of a whole world. So it's one big world, you are part of it, and you have to take responsibility. The moment you are aware of it, you can't be unaware. So you have to take action. Mm-hmm. That was it for me, at least. So I'm very curious about you others, what your thoughts are and ideas.
Well, thank you, first of all, for all of this. It's really inspirational, as Joost also said. I was wondering, what was for you the trigger or the inspiration to go and do this? What was the first you came in contact with it?
Yeah, I always get asked that question and I never have a good answer. I wish I had this little pretty box of I had this moment and then I was like, yes, but no, I feel like it was almost, I like being in different cultures. I love learning. So that first experience of going to China, I just wanted that new experience. But then once I was in it, I was just like, this is me, like, this is what I want. And I just kept kind of seeing what opportunities presented and kept allowing myself to be open to what would present and kind of saying yes to things. And that's kind of how I just kind of naturally went that way.
It's a wonderful story that you tell, because there's something of serendipity into it, that it kind of merges into each other, but actually at the same time it's constantly as a kind of a reflection loop which builds upon it. Every interaction kind of provided a reflection into you and get to a new action and taking even more responsibility and awareness. I think that's really amazing. Mike, you want to say something? I would say. I know you.
Well, I was gonna say, you know, April, like, you should maybe stop taking it easy and like work a little harder, you know. No, I'm kidding. I mean, wow, I mean, that's it, so many things. I think people in this session are going to hear this and say, wow, I want to be like April. I want to go and begin and start. And, you know, you and I have had this conversation. The different generations of global health practitioners have had different levels of training. And I think our next generation probably has an advantage to do better than certainly I have and we have. How would you suggest somebody hears this and say, oh, I'd really like to get started? What would be like step number one and maybe number two?
Nice question. So I think definitely start in the community you're a part of, right? Start to explore, like, what are those systemic barriers that it's making it difficult for people in your own community to have equal access and benefit? And then explore, like, that's good. That whole process of just exploring and trying to understand is going to also trigger your own development. So allow that to be also personal growth. And then once you kind of understand, see, like, well, how can I contribute to this? And also, what am I doing that's actually making this worse? And how can I take responsibility for this? And then what active actions can I take? And that's going to look different in every community. So I can't say, like, what are those practical things to do, but I think you can find them. And Mike, you might have the thought too.
Yeah, well, I don't know. I mean, I think just hearing you and I'll be honest, hearing you didn't say this, but I feel, though, and I certainly feel this, and maybe many others, the struggle of calling it global health, the struggle in defining it, and yet looking at a colonial past, and then ensuring that we don't make things worse by our very presence. So that level of conversation did not really exist 20 years ago, and now it does. So I think we're moving in the right direction, but I do think that there needs to be some strong formative years and professionalization of global health practice. Many ways that can happen.
And if you would have, if you had another hour, I could definitely tell you that whole journey, but all the mistakes I made, all the times I caused harm and I replicated oppression and colonialism, and how that journey also really, and I still do it, but I try, and how that really helped, shapes me.
That sounds also a little bit like the journey of global health, that you make mistakes and you try to do no harm, but at the same time, by trying to do good, you probably do harm, as Mike is saying, based on this privilege and this colonialism, and we have to go for deterroralization and see what's there. But actually doing nothing is even causing more harm than try to do. It's kind of what I hear from you. Am I correctly that you say it's an action reflection loop that you constantly use? So you reflect, you adjust. That's one of the most important parts. But action is something that you have to do.
Absolutely, yeah. That reflection and being purposeful and having space and time to actually do that. I think that's when I just get too busy and I fill up my life too much, that's when everything really suffers. But if I have time and space and people in my life to talk and question, that's when, the best kind of collaborations happen.
This is quite, yeah. The thing, what struck me quite a lot, and we have to go also to the question that my colleague is pointing out to, which is we have to start in your own community. And I think that most people concerning global health, as you say, they don't look upon it, that in our own little community, it's already there. There we have the inequities and the injustice and the systemic failures. So the first thing also what I start to think is the way how we perceive healthcare between illness-driven or more salutogenesis. Is it more health-driven, the contradictionaries? Or that's the system, for example, in the Netherlands, that we have a healthcare system that physiotherapy treatment is 25 minutes, which in itself is looking upon it that you say, well, let's keep to the 25 minutes because that's paid. So you take an external force, and then we talk about patient-centered care. Well, we have to at least to acknowledge the difficulty. I think that's, and a lot of things try to find the contradictions in cases, because only if we're there to look upon those, we can start emerging, and then the awareness will rise. Is that something also what you,
Yeah, absolutely. Taking a look at that. And then also finding like what actions align with your interests, your strengths, and your values. Because like, you know, I am not so keen on policy and legislation, right? So I'm not really going to be doing that kind of advocacy in the US, for example. But there's people who love that and are great at that, and that's needed. But that's not really me. So what are the ways that I can contribute that actually align with my strengths? And that's going to be more sustainable and more beneficial.
Yeah, so that also means that we have to take ourselves into account. That who are you, what's your value, and also see the added value of other people around you, so that in togetherness we will manage something, because you build upon each other with each other.
Yeah, and exactly. Everyone has differences, right, too, and creating all those, celebrating all those differences, and everyone working together in those differences.
Yeah. Then we got a question from Esra. Esra works for the Independent Doctors Association in Turkey. And she asked, I was wondering, how did you deal with language barriers with patients from all these countries that you work with? Can you tell something?
Yeah, sure. So most of the countries always have interpreters. So it is a priority that I do put into funding and planning and program development, because even if I can speak some basic language, like it's never going to be the quality that you have with an interpreter, and really language and how it's communicated is really essential. So I always work with interpreters, and I also will kind of bounce off that question, like language is not just the only thing, right? You really have to understand the culture and the context. And so, for example, in Kurdistan, like I think today I probably worked with people from like 6 different racial and ethnic minority groups, and probably like 3 different languages. And so they all bring in all these different differences and cultures and beliefs. And, you know, Kurdistan's a place that I've been the longest. And I feel like just now I'm really seeing the benefit of being somewhere long and really being embedded in the community and understanding, starting to get a depth of understanding of those different cultures. And so I think, and also, but still recognizing there's things I don't know and there's things I don't understand. And so having that balance.
Yeah, that makes sense. Concerning being longer time and immersed in the community, what you said also in your story, you have had that service for 2 weeks in Guatemala, which is kind of the complete opposite of being such a long time in Kurdistan. And sometimes you still see that people go into short service trips. Mm-hmm. And in this time, does that still have value, or would you prefer to say, okay, we have to take that from a different example? How do you look upon those things?
So I think the service trip has value for me and for the students, but I don't necessarily think they often have value for the communities, right? And I think they actually often cause harm in the communities. Yeah. And I know there is a lot of discussion around that with global health. And so I think I'm coming to terms with the fact that they will just remain. Like that is just because of all these different factors, these short-term trips will remain. So we do need to create a global health community that's working to help support them to be not harmful and just actually have benefit in the communities.
So that probably means that it might be interesting to, if we, together with the experience from you and from Mike and from others, to find a little bit of guidance in how can we come up with global health, but also not seeing it from a North European perspective, because that's maybe the worst thing in the world, to actually look upon it from just that part of the world, isn't it? That's sometimes this the difficulty in a lot of people. That it means that you have to take different parts. Mike.
There are some guidelines on that, Joost. But quite honestly, the LIMS, like April mentioned, is an NGO that has a long trajectory, stays, replicates, etc. And those are more on the sustainable. April, I think you'd agree, more on the sustainable side. The ones that are not are the ones that really kind of keep me awake is the pet projects of certain, oftentimes in universities, mostly based in the areas where I live, who have an interest, and it becomes really, really tragic. And those are the ones that we really need to focus on, and less the ones that April mentioned. I'll give you a quick example. What we see a lot of times is even PT students will practice and do things way beyond their scope, like way outside of their scope. And there's an added element in the United States because it's it's trained at a doctoring level, so that adds complexity to the doctor title. So there's simple ways of making it happen, but it has to be on the individual who initiates to seek out some of these the advice and guidance.
Yeah.
Like for instance, there's no we do ethics review for all the research we do. There's no IRBs for short-term, involvement. There should be, but there's not.
This makes sense. So then my final question would be concerning health situation. I think that this might talk before already of this COVID period, and when you see what's happening now in Western Europe in lockdowns, curfews, things that nobody expected before. In adaptability of society, I think it's very low in most Western European countries. That's just my narrow-minded view. Then I think that, for example, people in Kurdistan, they to me, it look like they have a little bit more creativity, maybe, in dealing with things. Are there things that we could learn that because I think that we should refocus actually more in this kind of ways? Would there be things that we can learn from the society, from Kurdistan, where you are right now?
Yeah, absolutely. There's tons. But now you put me on the spot to think of one.
Sorry, no, I don't.
No. But yeah, you're right. I do feel like the communities here are much more adaptable, right? With COVID-19, they're like, okay, here's this thing. We'll just figure it out, right? And I also kind of think of that when you're referring to how where you are, you have 25-minute physio sessions, right? Like because for better or worse, because the health system is not so structured, there's a lot more creativity and fluidity and ability to do what is best for the clients and communities. Now, there's also lots of challenges with that, but what that means is, like, for example, when we create a program service, we can say, like, this is what's realistic. This is the length of the sessions. These are where it can be held. This is the documentation that's actually helpful for the clinicians and not for funders or someone else, right? So there's a lot more creativity and responsiveness that can happen when you're not fixed in a system, right? And I think they're developing, and we're finding that fix, but I feel like because of the culture, it'll always have that flexibility, inshallah mentality.
And I think, this is nice what you're saying. I think that is something that a part of global health will also be starting to learn with each other. Instead of learning as teaching, it's more learning as learning. It's learning as co-development, co-growth, co-construction, co-creation.
Absolutely. And I know I've changed a lot from being part of this community. Like, from an American perspective, Americans are very, you follow a plan and time, you follow time. But now I'm very different, and I'm more creative now, and I'm more responsive because, I've learned from them about how to do that and how to adapt and the benefits of that.
Oh, yes. Great. I really want to thank you, April, for sharing your story with us. One thing I know for sure, this isn't the last time that I called you out. You definitely get in touch, and I hope to ask you if you can help our university also by integrating a little bit more of global health. So I will reach out to you for that one. I will thank everybody here on the board. Mike, we will see you tomorrow again.
And I'll just say, if anyone wants to learn more, connect with me. My email was shared, and so feel free to do that. I'm always happy to help.
Oh, wonderful. So I will put it also again in the notes, and then